Talks. Personal injury. Leaders in Tennessee Medical.
From sprains to strains, Soft Tissue Injury 101. After experiencing an automobile accident, the first thing you should think about is your health. Accidents are to blame for a substantial portion of death and injury across all age groups in the United States. What exact injuries someone experiences following an accident is entirely case-dependent. While there is no way to confirm injuries without seeing a licensed care physician, familiarizing yourself with common injuries can promote understanding. What are soft tissue injuries? Your bones are not the only thing that can be damaged or broken during an accident. Soft tissue damage refers to the medical conditions where other areas were injured. For the most part, soft tissue injuries refer to the damage of tendons, ligaments, and muscles. These are commonly the results of accidents or trauma, but can also be the result of overuse. What are the different types of soft tissue injuries? There are several different types of soft tissue injuries. Some are more common than others. Contusions. A contusion is the medical term for bruising. It is the result of a traumatic force damaging tissues under the skin and causing blood to pool underneath. Sprains. A sprain occurs when the connective tissue, ligaments, are damaged. These tissues are crucial for movement, as they connect bones to other bones. Although they are inherently elastic, they do have their limits. When stretched excessively, they can become sore or tear. Tendinitis. Tendinitis is a condition that arises from overuse rather than injury. If you continuously move in a certain way, it can aggravate tendons, resulting in injury. Tendons are another tissue crucial for movement, as they are used to connect muscles to bones. Bursitis. The movement of anything can cause a lot of friction to occur. In the human body, we have special security measures to cushion bones, muscles, and tendons from rubbing against each other. These cushions are fluid-filled sacs called bursa. When these become aggravated, bursitis may occur. This aggravation often arises from overuse, but it is possible to injure bursa through physical trauma as well. Strains. Like sprains, strains involve the excessive stretching of an elastic connective tissue. Strains refer to damages to the tendon when it is either stretched or torn. While these conditions are all classified as distinctly different phenomena, they are all similar in symptom expression and treatment. Although everyone experiences their injuries differently, there are some symptoms that one may recognize as an indication of soft tissue injury. Pain. Experiencing pain and discomfort is one of the most common characteristics of any injury. Localized pain at the site of the injury for the early stages of recovery is something one should expect. Inflammation. Another symptom commonly experienced early on is swelling where you injured yourself. Swelling and inflammation vary depending on the severity of your injury. Weakness. During recovery, it may be incredibly uncomfortable or impossible to maintain pressure on the injured area. Discoloration. Bruising or redness in response to the recent trauma may appear on the injury site. Depending on the specific type of injury you experienced, you may have other conditions to look out for. Comorbidity with specific soft tissue injuries is not uncommon. For example, someone experiencing whiplash may also have suffered a concussion, herniated disc, or lower back pain. Always express any symptoms you experience with your doctor. It may seem unrelated, but things such as attention impairment and a sore neck may be related. What do I do after a car accident? It can be challenging to remain level-headed right after an accident. While there are several small steps you should follow, always prioritize your health. If you don't need to go to the emergency room, it can be a smart idea to seek medical attention at your earliest convenience. While it's hard to ignore a broken leg or large cut, some soft tissue injuries may not be so apparent. There are some common injuries, such as whiplash, which often do not appear for several days. Just because there is a delay in symptom experience doesn't mean it shouldn't receive medical attention. Failing to receive treatment when you need it can have negative consequences on your health. Seeing a doctor as soon as possible gives you the most significant chance of identifying your condition early and getting the treatment that you need. How do I get the treatment I need? It would help if you found a medical care physician experienced in accidental injuries. A licensed doctor will be able to help you with all aspects of treatment. Knowing what type of treatment to expect before visiting a doctor can be difficult. Soft tissue injuries vary in severity, and some more extensive scenarios may require more intense treatments. Luckily, soft tissue injuries are often easy and safe to treat. Many times, patients look more for pain management options and advice on how to have a safe and healthy recovery period. Some people may even want to seek advice from a chiropractor or physical therapist to work on their posture or movement. Whether you are interested in getting in touch with traditional pain management doctors or homeopathic treatments, we may be able to help. We know that experiencing an accident can be incredibly stressful, and we hope we can take some of the stress away today. At Midtown Medical, we pride ourselves on being the #1 source to accidental injury care. Thank you for joining us in this installment of Midtown Medical Talks.